XHANCE is a prescription medicine used for the treatment of nasal polyps in adults. Please see the important safety information at the end of this video. Brian's story, a patient's perspective.
My name is Brian. I am 33 years old. I'm a full-time musician in Charleston, South Carolina. I've been married for 5 years to my wife, Taylor, and I have a French bulldog named Petey Taco. I've dealt with constant sinus pressure my whole life. All the headaches and the pressure, constant drainage. It's like trying to blow your nose, but you can physically feel a blockage. So you can feel all that stuff in the back of your head, but nothing will come out. It's so annoying. I've tried nasal sprays, but they didn't do much for me. I've also tried saline solutions. They didn't work either. If I had a gig, I would beg my doctor to give me a steroid or just something before a big show, just so that I could get through singing and performing. It was tough. I'd be on the mic and would have to turn my head away from the crowd because of the immense pressure and pain. And then I'd have to turn back around and put a smile on my face, and the crowd wouldn't know the difference. I couldn't sleep, because I couldn't breathe through my nose. I'd wake up kind of almost choking, because if I was sleeping, the drainage would eventually go down, and then I would cough and wake myself up. You also can't sleep when you have massive headaches. The first time I heard the term nasal polyps was actually from a specialist, my ENT. He said, listen, you can't continue to take oral steroids all the time. You can't keep taking all this medication. That's when we decided to do the surgery. My first one was about 10 years ago. After the surgery, I still had symptoms, so I feel like I tried everything. I went back on allergy shots, but nothing was helping, and the polyps started coming back. My doctor said, here's the deal. It's something you're always going to struggle with. Surgery will wipe the slate clean, but we need to prevent them from getting as bad as they were. After my second surgery, I was still experiencing symptoms, so my ENT said, I'm bringing in a colleague of mine who specializes in treating patients like you. He was the one who told me about XHANCE. He said, we're getting good results from our patients. Would you be interested? And I said, yeah, I'd be willing to try anything at this point. He showed me how to use it. It was super easy for me. Once I started using XHANCE, the biggest thing for me was that I wasn't waking up with congestion anymore. I stopped feeling the constant pressure. That's for sure the biggest difference. If I'm singing, I don't get headaches, and for someone who has always dealt with that in their entire life, that is everything. I think I'm about a year in with XHANCE. I use one spray in each nostril in the morning and at night. I don't even know how long XHANCE has been around, but yeah, I wish I had treated my nasal polyps sooner. If I could give other patients advice, I'd say go see an ENT or allergist. See someone who really knows and really listens to you. And then I would just say, you gotta try it, man. It works for me, so give it a shot. It's just like a sign of relief, because I thought I was gonna have to deal with this until the day that I stopped singing. It's a relief knowing that there's something that actually works, and that just gives you a sense of peace, knowing that you don't have to be in pain up here all the time.
Important safety information. Do not use XHANCE if you are allergic to fluticasone, propionate, or any of the ingredients in XHANCE. Get emergency medical care if you get any of these signs of a serious allergic reaction: rash, hives, swelling of your face, mouth, and tongue, breathing problems, or low blood pressure. Tell your healthcare provider about all your medical conditions and medications that you take. It is especially important to mention if you take antifungal or anti-HIV medicines, as they may interact with XHANCE. XHANCE can cause nasal problems such as nosebleeds, crusting, sores, hole in the septum, and slow wound healing. XHANCE can cause eye problems, including glaucoma and cataracts. You should have regular eye exams when using XHANCE. XHANCE may increase the risk of infections and make certain infections worse. Avoid contact with people who have a contagious disease such as chickenpox or measles while using XHANCE. XHANCE can cause reduced production of steroid hormones by your adrenal gland, resulting in tiredness, weakness, nausea and vomiting, and low blood pressure. XHANCE can weaken bones, osteoporosis. Other side effects may include redness, pain, or swelling of the nose or throat, thrush, fungal infection of the nose and throat, nasal congestion, sinus infection, and headache. These are not all the side effects of XHANCE. Call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Before using XHANCE, carefully read the FDA-approved patient information and instructions for use.